Whoops, not yet.
Good afternoon. My name is Frances Graham. I serve as the president of the Chapel Hill chapter of Alpha Kappa Alpha Sorority Incorporated, Mu Omicron Omega. I am pleased and honored today to welcome all of you to the COVID-19 vaccine Make an Informed Decision panel discussion. We're very excited to have this partnership with the NAACP of Hill-Carrboro and Chapel Hill, and also the Orange County Health Department. We thank you for being here today and look forward to your questions and look forward to an engaging conversation around this very important, discussion topic. So without further ado, we will move forward, knowing that we thank you all again for being here and appreciate all of your time, your interest, and your talents. Thank you.
Good afternoon, everyone. My name is Krishna Vani Balakrishnan, and I work for the Orange County Health Department as the Healthy Homes Coordinator and the Deputy Public Information Officer. I want to extend my thanks to this entire group here today for partnering and for offering a partnership with us to present today. And today we're going to be providing information on the current status of COVID in Orange County. And I will be showing you all some data trends and also providing some information on cases and current vaccination status for our populations here in Orange County. So I'm going to share my screen here. Okay. So here we have, this is the data that we release once a week. It comes out every Friday. We have a press release from our communications team where we showcase the current data trends of COVID-19, our cases, our demographic data, and also the number of vaccines that we have given to our residents here. So the total number of cases in Orange County as of today, released by the state at 12:15 p.m., is we have 7,822 confirmed cases of COVID in Orange County and 97 deaths. And here, in terms of doses administered, first doses, we have administered 5,820. Second doses administered of the vaccine are 3,524. And this is first doses that were allocated for the week of March 8th, 2021. We received 500 from the state. We currently have 20,000 folks who are registered to receive a vaccine in Orange County, and 18,000 people are currently on the wait list for groups 1, 2, and 3. We will be entering group 4 on March the 17th. And we are able to move forward with vaccinating folks for group 4. We receive a certain allocation from the state each week, and with vaccine production going up, we are able to start vaccinating people in group 4. So we're encouraging people to sign up and register, and I'll be able to provide that link in the group upon the end of this presentation. So here, a breakdown of our demographics of those who are receiving the vaccine. For ethnicity, we have close to, the majority is not Hispanic or Latino, with close to about 95%. And we have a small percentage of those who are Hispanic or Latino, who identify as Hispanic or Latino, that are receiving the vaccine. For gender, the majority of folks who are getting the vaccine currently are female at 60%. Male, we still are about at 40%. And then for ages, our largest population that are getting vaccines are 75 plus. And the majority of those who are getting the vaccine as of right now in Orange County are those who identify as white, at least on their CVMS registration link. So we're working closely with our local groups to try to work closely with our communities of color to encourage access to the vaccine, especially in the northern part of the county. And this upcoming week, we are going to be having a vaccination pod for farm workers in the northern part of the county, and looking to host various events throughout the month with local communities to increase access. Last week, we did Cedar Grove Community Center. And then we've done different communities in Chapel Hill as well. So we're working to try to increase that piece as well, because we're seeing in the data that a lot of our communities of color are not getting the vaccine or not having access to it. Here, this is just an indication of age of confirmed cases. The largest percentages for age groups are 32% for groups in the age of 18 and 24, and groups in the ages of 25 through 49 at 32%. We have a less number of cases for those in our older adult populations. For middle age folks, about 15%, and then under 18, we have about 11% of those under 18 who have had COVID. In terms of gender for confirmed cases, women, it's more cases that we have, so about 53%. And then for male, it is 47%. And with the OC population, it's about roughly the same, a little percentage off, because we do have those who live on the county line. And the data that we feature in the dashboard, this is information that's published in NC COVID, which is a database that we use. And those are all laboratory confirmed cases. Some days it might shift a little bit. So if we see a different number on the state website, we try to make sure that we reflect that on our own website as well. So the number of confirmed cases for our Black populations here in Orange County, we have about 14% cumulative confirmed cases. For whites, we have about 51%. For other who identified on their CVMS application, 22%. And then for Hispanic and Latino, 13% as well. And each day we provide an update. So I'll also include that in our group chat. We include an update every day around 12:45 of the number of confirmed cases and the number of deaths as well. And that is just our daily case count. We have seen a trend that's gone down significantly since vaccinations have gone up. So it's slowed our number of positive cases in the county. And here is just the end of the presentation, where it's just showing different data tables of the confirmed Orange County cases, COVID-like illnesses in Orange County emergency departments, percent of positive total Orange County cases, and then state confirmed cases hospitalized. So we are seeing a downward trend, and it has been like that significantly since February. And yesterday, North Carolina reported the lowest number of reported cases since the beginning of the pandemic. So since March 12th of 2020, we have had the lowest number of hospitalizations and reported cases in North Carolina. And we believe that that is due to not only our efforts from our public health warriors all across the state, but also for our communities who are sticking to their 3 Ws, wearing their masks, waiting 6 feet apart, and also washing their hands. So we extend our gratitude to our communities, not only here in Orange County, but across the state, who have been vigilant in trying to make sure that they're staying safe during this time. And this is just a trend of the daily confirmed cases. We've seen peaks. Sometimes this is just show an indication of during the holidays and how it's gone up and shifting down. And for some demographic groups with very small numbers, those have been suppressed to protect confidentiality, because we might have one case and that could indicate someone's personal information if we report that. So race and ethnicity data is missing for approximately 15 to 25% of our confirmed cases. And additionally, the dashboard only includes data from residents being tested. So just keep in mind, this is just a picture. It doesn't show the full picture, but this is just an indication of our current trends here in Orange County.
Good afternoon. My name is Angela Robinson. I'm a member of Mu Omicron Omega chapter of Alpha Kappa Alpha sorority. I am a COVID survivor. I say that and I don't take that lightly, because I know there are many, as you know, have not survived COVID. I contracted COVID in December
of last year. My duration of symptoms lasted for at least 6 weeks. Per my physician, my case was a moderate case. The onset of it was a severe fatigue, headache, fever. I ended up having to take a trip to the emergency room in respiratory distress, was treated and released. I was one aspect of the symptoms that I do want to touch on is the increased anxiety. I had severe insomnia from the disease or the COVID, not knowing whether the symptoms were going to be severe enough, whether I would survive COVID. I think contributed to that. Having a child in the home who I wanted to make sure didn't contract COVID, and thankfully he didn't. So I do want to bring attention to the emotional aspect of COVID and being worried and concerned about whether you will survive COVID. I am also one who has taken the vaccine. I actually had a second dose within the past week. I was considering taking the vaccine even ahead of actually contracting COVID because I felt like it was the best way to protect me and my family from being exposed to COVID. I did not have any severe symptoms or side effects. I actually had just the mild soreness, the first dose, a headache, but nothing other than that. I am thankful for the opportunity to have taken the vaccine and feel that, it is something that I can do to help reduce the spread of COVID. I am happy to share at this point with anyone who is concerned either going through COVID or actually experiencing some emotional distress from COVID, to share with them my story and to provide support. One thing in retrospect that I wish I'd done more of is to share more with people during my experience with COVID, to allow that support at that time, because I think it's very helpful. But thank you for the opportunity for sharing my story regarding COVID and taking the vaccine and my choice to do so.
Good afternoon. My name is Landa Scarlett, and I am a member of Mu Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated. I am honored and I am excited to serve as the moderator this afternoon of a panel that is a combination and partnership between the Orange County Health Department and also the Chapel Hill-Carrboro branch of the NAACP. We are all excited to talk to you about the COVID-19 vaccination and also be an integral part of you making an informed decision. My task this afternoon is to introduce our panelists and also moderate our question session. And I would encourage you to go ahead and start to populate the Q&A box with questions. We are very, very, very just glad to have so many talented individuals accept our invitation to participate on the panel. I will start the introductions with Dr. Crystal Wiley-Sinay. Dr. Sinay is a physician. She is employed by UNC Health. She is a researcher and a stellar clinician. She serves in the capacity as the director of the Cecil G. Sheps Center for Health Services Research. She is an internist by training and has a love of her community and family. If you read Dr. Sinay's reviews, they are excellent. She works very hard to reduce health disparities among the communities of color. We are also honored to have with us this afternoon Dr. Michelle Laws. Dr. Laws is the Assistant Director for Consumer Policy and Community Engagement at the North Carolina Department of Health and Human Services. She serves to work in the areas of mental health, also developmental disabilities, and substance abuse services. Dr. Laws is a busy lady, a very busy lady. She is a liaison between us and our local government. She has served as a legislative liaison for the NCDHHS division, and she's working there while also teaching students at both North Carolina Central University and NC State University. A very special thing that Dr. Laws also is committed to is the education of incarcerated persons. Dr. Richard Watkins is a researcher and is also employed by the UNC system. By training, he is a virologist. He's also the founder and CEO of the Science Policy Action Network. This organization was formed in 2014, and it works to fill dangerous gaps between scientific advancement and the stakeholders. Dr. Watkins is a member of the UNC chapter of Sigma Xi. That's an international honor society with famous persons inducted, we know by the names of Albert Einstein and Francis Crick and James Watson, who were important in the science behind DNA. Dr. Watkins is an athlete. He played football at Fayetteville State University while he was a Chancellor Scholar. He's a highly recognized virologist, and he is a classmate of Dr. Kismia Corbett, who was instrumental in development of the Moderna COVID-19 vaccine. We are honored to have Dr. Ivan Savio participate on our panel this afternoon. By training, Dr. Savio is a physician. He is an internist and has specialization in the area of geriatrics. His practices have spanned from Virginia to New York. He's been in practice for more than 24 years and is on the front line in our community. And if you look at his reviews, they are excellent. He is described as being a communicator. He's described as being able to break down the science so that you can understand it. So without further ado, I want to move forward and let us talk with our panelists. And we will hear from our panelists in this order, please. Dr. Crystal Wiley-Sinay, Dr. Michelle Laws, Dr. Ivan Savio, and Dr. Richard Watkins. And please keep those questions coming in the Q&A box.
Thank you, Dr. Scarlett. So thank you all for the opportunity to be here and to be among these esteemed panelists and colleagues, and I really appreciate it. As Dr. Scarlett said, I'm Crystal Sinay. I'm a general internal medicine physician and a health services researcher at UNC. I'm a health equity researcher. I'm also the system executive director for health equity for UNC Health. And in that role, I have spent a lot of time over the past, 3 months preparing for the COVID vaccination and leading UNC Health's efforts to make sure that we are providing opportunity for minoritized and marginalized communities to receive the COVID vaccine. So I'm really just happy to be here to be able to talk. We certainly want to make sure that we are moving people along a continuum towards vaccination should they choose to receive it. But our primary goal is really to make sure that there is equity in the opportunity for people to be vaccinated. We recognize that not everyone is ready yet, and we feel that it is our goal to make sure that there is vaccine available and that you have a spot at which time that you're ready to be vaccinated. So I look forward to the discussion. Thank you.
My name is Dr. Ivan Savio. I thank you for inviting me to this webinar and appreciate the fact that I'm here and I want to share my views and also my thoughts. I encourage everyone to keep an open mind and also to we will do what we can to kind of dispel the myths and also discuss the facts. From my experience, there's still a lot of not understanding what this vaccine is, what it does, where to get it. Also, I've noticed in my experience, there are preferences of which one to get. Hopefully with this panel, we will all share, combine our knowledge together and also share this. And in regards to my experience, I am an internist. I also did a geriatric fellowship, and I also see a lot of individuals in the geriatric population. My practice is in Northern Virginia, but I want to share my experiences with everyone and inform them that there are a lot of key issues that have evolved from this pandemic and that need to be addressed post-COVID, whether infection or vaccination, and hope that that we share our knowledge of this condition. Thank you.
Good afternoon. It is an honor to be with you all today. As my introduction stated, my name is Richard Watkins. I got my PhD at the University of North Carolina, Chapel Hill, where I was trained as a virologist. And yes, you heard that correct. I trained alongside Kazmikia Corbett, the person who developed basically all of our vaccination approaches and was instrumental specifically regarding the Moderna vaccine. I did my work in HIV and understanding a lot of the mechanisms that allowed HIV to progress towards AIDS in HIV infected patients. From there, I joined arguably one of the country's greatest undergraduate scientific training programs, the Chancellor Science Scholars Program at University of North Carolina at Chapel Hill. And I also founded and am CEO of the Science Policy Action Network, where we focus on research, consulting, and outreach to benefit all of North Carolina. I am very concerned regarding this particular pandemic, and that's why I am so honored to speak alongside such amazing panelists. Over the past 15 to 20 years, around 10 coronaviruses have crossed over from their bat hosts into humans, 7 of which didn't really cause much of an issue, cold-like symptoms, if that. 3 of which, however, were able to cause severe disease: SARS, MERS, and now SARS-CoV-2, the causative agent of COVID-19. We are going to continue to deal with coronaviruses for years to come. And I would urge each and everybody here to take this very, very seriously, because what we are able to do now will be the blueprint, and it will be the approach that we take in other coronaviruses that surely await us in the future. And there is no guarantee that the next coronavirus that we deal with will be less severe than COVID-19. It is a possibility that the next coronavirus that we deal with can be worse than COVID-19. So it's very important that we get our act together. And briefly, I will say this. There is a lot of feelings, understandably, that we are seeing the light at the end of the tunnel. And sometimes what happens when you start seeing the light at the end of the tunnel, it reveals to you just how dirty and messed up the tunnel itself is. We have vaccinated roughly 10.9% of the United States population. It is going to take anywhere from 50 to 80% of the US population to be completely and fully vaccinated before we can get to the so-called herd immunity. And as we leave the elderly population, we are going to run into a lot of vaccine hesitancy and a lot of skepticism. So it's very important that panels like this continue to happen. And I'm so very proud to be alongside this panel today. Thank you.
Hi, I'm Dr. Michelle Laws, and I too am honored to be a part of this esteemed panel. I am a native of Chapel Hill, born and raised, went all the way through undergraduate school there. So from elementary with a brief period when I lived in Newark, New Jersey with my mom, went all the way through school, up through receiving my undergraduate degree from Carolina, UNC Chapel Hill, and then a master's from North Carolina Central, and went on to get my PhD from VCU School of Medicine. And my area of expertise is as a social and behavioral scientist, is looking at social and behavioral factors contributing to chronic disease among historically marginalized populations, with a specific focus on African-American women. And I, have been working on the front lines with Secretary Mandy Cohen's COVID response team as one of the leads for our historically marginalized populations work group. And so looking at ways that we could stand up services quickly and in a timely manner to respond to the disparate impact that we were seeing this virus have on historically marginalized populations, including African Americans, Hispanic, Latinx, and our American Indian populations, as well as refugee populations. And I would like to say that, orienting a lot of the work that I've been doing, and a lot of my focus, is the realization that our communities, African Americans in particular, came into this pandemic already shouldering a disproportionate share of the disease burden when we look across different multiple chronic health conditions, and whether it's diabetes, hypertension, renal failure, and the like, or kidney disease and the like. And so what we've seen transpire, unfortunately, in different ways, from testing to vaccines, getting the vaccine or vaccine access, is this whole theory of cumulative advantage and cumulative disadvantage play out through the way in which services have been delivered, as well as access. We have intentionally focused on really increasing confidence in the vaccine, understanding that right now, as we are looking at the deaths and we're looking at the cases, we're still seeing a disparate impact. We saw it from the beginning, that this vaccine is really a game changer, but that people are fearful, were fearful initially and hesitant, but we're seeing the hesitancy go down, and particularly in African-American communities, largely because of the education that we've been doing, working with community-based organizations and faith-based organizations. But we know the fears and the hesitancies are real, and they're rooted in what I coined as historical medical traumas. And those historical medical traumas have been triggers, or are triggers, for some of the fear and the hesitance that we see. And so the whole infamous Tuskegee syphilis study that was done in 1932 or started in 1932, the eugenics project in North Carolina that ran from 1933 to 1973, Dr. Eugene Sanger's Cincinnati radiation study that ran from 1960 to 71, where he exposed intentionally to look at the effects of radiation on the body, 88 men and women, mostly, and some children who were mostly African Americans, to high levels of radiation, some who died immediately. Henrietta Lack's story, the HeLa cells, how she goes in to get treatment for what were abdominal and pelvic pain, discovered that she has cervical cancer. Her cells are taken, used by Johns Hopkins University and researchers within that university to study cancer without her consent, cells taken, family not notified until decades later. Dr. James Merriam Sims, known as the father of gynecology, how he honed his craft, butchering slave women's bodies, basically, and reproductive systems, right? And so we've got these historical medical traumas that are triggers to how we're responding to the vaccine, how we're responding to medical treatment. And that's in the background of what we're seeing in terms of, like I said, the cases and the deaths. Who's most likely to die disproportionately? Who's most likely to experience and suffer from long haul effects without being able to recover as quickly as other populations are African American? But I also say that past is prologue, and it simply shined a light. COVID shined a light on the fault lines of our public systems and ways that we need to improve those systems to be more responsive to historically marginalized populations. Past is indeed prologue. I too have to run to that rally today to speak on in honor of commemorating the life of Breonna Taylor, and not her killing, but add all of what we're seeing with the COVID pandemic, add to that the ongoing traumas and traumatic experiences of our communities. And so I'm glad to be here to talk about informed decision making and what that means for us, and to share my model of informed decision making from an equity perspective. And that has to, and how we have to consider our past. We also have to consider some of the things that are happening today, social justice issues and other things that are happening today that are influencing our decisions about medical treatment and care. Glad to be here. Thank you. And I do want to make a correction, because I don't want any of people who've said, "Are you still teaching at Central?" So I am not teaching, haven't taught in the last year or two, actually 2 years. But certainly do look forward to the day when I can return back to the classroom. I have a few people who've said, "I've been looking for you on the to take a class from you." I will be back, but thank you. Good to be here.
Thank you, panelists. Thank you, Doctors Wiley, Sinay, Watkins, Savio, and Laws, for your introductions. I would like to kick off our Q&A question with a specific question for Dr. Watkins. So we all start at the same place and knowing how the vaccine works. Dr. Watkins, could you explain to us how the COVID-19 vaccine works?
Absolutely. And the first thing that I'd like to say is that everybody in my family who can be vaccinated has been vaccinated. I received my first dose of the Moderna vaccine on Wednesday. I didn't even have any soreness in my arm, but you can expect some soreness. And then you can expect some malaise or some mild flu-like symptoms after your second dose. And I'll get into a little bit of that. So the Moderna and Pfizer vaccines utilize what is known as a messenger RNA platform. Messenger RNA, or mRNA, are one of the most fundamental aspects of human biology It's basically the blueprint or the recipe for which all proteins are made. Now, the body needs to make COVID or SARS-CoV-2 proteins so that it can train its immune system to protect itself. So a lot of times what happens is people aren't able to protect themselves because they've never seen a virus before. Your body needs to have a blueprint, a playbook for how to defend itself against a wide variety of pathogens, including COVID-19 or SARS-CoV-2. But we don't want to wait until we contract the virus to start mounting that educational aspect of our immune system. So what we do is we can go ahead and before you get infected, we can give your body a playbook for which it's able to train itself. And that's kind of like the mRNA platform. And in a nutshell, what's contained in the Pfizer and Moderna vaccines, in a nutshell, and you can look all these ingredients up, are basically salt water, sugar, fat, and mRNA. The fat coats the mRNA because mRNA is very vulnerable to degradation because your body just turns over mRNA constantly. And so it's very fragile. And so the fat coating the mRNA protects the mRNA and then allows it to get into the cell. And then your cell does all the work from there. It starts producing the protein known as a portion of the spike protein. And from there, your body starts designing immune responses for that protein. So by the time you ever come into contact with SARS-CoV-2 or COVID-19, your body is ready to defend itself. The Johnson & Johnson vaccine utilizes basically the same approach, but it is DNA-based. And instead of surrounding it with fat, it's surrounded with a fat layer that is composed by an adenovirus. Now, it's just the husk of the adenovirus, which is a cause of the common cold, but it has none of the other components of the adenovirus. It's just the husk. And it's just a vehicle for which the DNA is able to enter the cell. Once that DNA enters the cell, mRNA, RNA is transcribed from that and then translated into protein. And boom, your body is ready to defend itself against SARS-CoV-2 or COVID-19. Pfizer, Moderna, 2 shots, you go in for 1 dose, 21 to 28 days later, you get your second dose. That first dose, you only get around 50% protection against symptoms, not protection from contracting the disease, symptoms or contracting the virus symptoms. And then you go in and get your second dose. And that's when your immune system ramps up to around 95% protection from the development of severe symptoms. And that happens around 10 to 14 days after your second dose. The Johnson & Johnson, just 1 dose, 10 to 14 days after that 1 dose, you get around 70 to 75% protection from the development of symptoms. But it's still important after you're vaccinated to wear a mask because again, this protects you from symptoms and it's not necessarily protecting you from transmitting the disease, transmitting the virus to people who have yet to been vaccinated. And I'll just remind you again, only around 10% of the population has been fully vaccinated to this date. So in a nutshell, that is how the vaccine works. Hopefully that was clear.
Thank you. And Dr. Wiley Sinay, I think I understood Dr. Watkins to say that it's possible to contract the virus even if you have been vaccinated. So would you comment on that, please? Does the vaccine guarantee that you won't contract the virus or that you won't get sick?
Right. So there's no guarantee. It significantly reduces the risk that you're going to get sick. You getting sick or exposing others. I think the key thing to keep in mind, Dr. Watkins referenced the fact that what we call the effectiveness or how well these vaccines do at keeping you from having symptoms. There is some difference between the Pfizer, Moderna, and the Johnson & Johnson. But I think one thing to keep in mind is the thing that we all want to avoid and we want our family members to avoid is getting hospitalized or dying. And all of these vaccines are great. Johnson & Johnson is 100% protective from hospitalizations or death. Pfizer, Moderna, also high 90s, 95% or more. So again, there's no guarantee that you're not going to contract the virus, but that's okay, because what we're concerned about is, are you going to get really sick from it? Are you going to get hospitalized or die? And so that's what these vaccines are really good at preventing.
Thank you.
Mhm.
Dr. Savio, we'd like to know if vaccinated individuals could actually give other persons COVID-19.
That's the thought process, that even though once you get the vaccine, you won't develop the serious symptoms, you can become a carrier. You can inhale the virus, and those who are not vaccinated can still uh, obtain the virus from an individual who's vaccinated. So this is why we strongly encourage to still wear masks, social distancing, wash your hands. Uh, Once everyone in your family unit is vaccinated, everyone, with the second vaccine, again, yes, you can use less and less of the mask, but I would still encourage everyone to follow the guidelines of wearing masks, hand hygiene, and also social distancing. Um, this is Now, I should also point out one important thing that has been a misconception. I have a number of people who ask, well, if I get the Pfizer vaccine first dose, can I get the Moderna as a second dose? The answer is no. You can't do that. It has to be Pfizer to Pfizer, Moderna to Moderna, or just the one Johnson and Johnson. And also, I should add, uh, this should not be the efficacy should not be used as a criteria to prefer one versus the other. I use the analogy, this is not like going to Burger King or McDonald's and you pick a Whopper versus an Impossible Whopper. This is not the time to do that. This is the time to just get vaccinated so you don't get the severe symptoms, but we reduce the hospitalizations. Right now, there is high demand, low supply. So my point is, please get the vaccine as much as you can. Please do not be selective at this time.
Thank you. Dr. Laws, could you please tell us what the current projected time frame is for other groups to be eligible to receive the COVID-19 vaccine? Those who are less than 65 years old, non-essential workers, and our teens who are 16 to 21 years old.
So right now we are at group 3, and that includes the essential workers and all the others, 2 and 1, obviously. So you don't lose your place, or we don't stop other groups from being able to get access to the vaccine or get vaccinated. So 1 and 2, which are the 65 and older, and also 1 is the long-term care facilities and our medical facility workers, medical care workers. And that includes, I do want to say that group includes persons who are working in COVID wards that are serving food, so food service for people. That includes the janitorial folk. So now we are at 3, which we started February 14th with the teachers. And then we started February the 24th, with the child care workers, and that's teachers and anyone in the child care industry. So that's working in daycares, pre-K and the like, private schools. On March 10th, I'm so excited, March 10th, we added additional frontline workers that included clergy. So right now we are doing all the essential workers, and there's a list of who essential workers are. I can share that, pull up a screen, or just read down through it. And then on the 17th, we are opening it up to adults with chronic health conditions, and that group will be people who are at increased risk of severe illness. And so right now, that's where we are, and we're hoping that we can move into group 5, which would be everyone else, all those other folk, shortly after March. And so we're not sure exactly when. We don't have a date just yet. But if things go as they have been going, for example, the secretary sent out a kudos to the team that's been working on the mass vac sites and the others. So we have currently a mass vaccination site that's run by FEMA that was stood up, and that's in the Greensboro area. And then we're doing these allocations, what are called equity allocations. And so we're trying to give bumps to communities that have that had low response rates in terms of, or access rates really, in terms of historically marginalized populations. And in one day we did 90,000 doses. And that's a long way from where we started when we first started back in December, right? And when we looked at the data, December through the end of January, early February, and we saw the gross inequities, the disparities, over 80% of white, all the doses that had been dispensed at that time were white, and then less than 10%, right at 10% were African American, when we make up 22% of the general population. So on the 17th, if you have a multiple chronic health condition, you will be able to start getting appointments to get vaccinated. And I do want to underscore what Dr. Savio said, Dr. Sinay, basically, and Dr. Watkins, really, now's not a time to try and cherry pick, because they both, all three, Moderna, Pfizer, and the J&J or Johnson & Johnson, will give you the protection that you need to stay out of the hospital, and therefore to prevent also deaths. And African Americans continuously have made up disproportionately the largest percentage of those people in our state who are dying. And so it's important, when your shot comes up, when your spot comes up, take your shot, and get in and get yourself vaccinated, as well as your loved ones and your family members. It's extremely important. So the 17th, we're getting there. We'll be at 4. And then hopefully soon thereafter, sometime in April, we're hoping we'll be able to open it up to 5.
Yes, thank you. I have a question that I would like each of the panelists to address, please. And this question is coming to us from the audience. And the question specifically states, why do professionals such as yourself trust this vaccine, which has not gone through the traditional testing and evaluation process, parentheses, years in parentheses, other vaccine development normally goes through?
Go ahead. Do you want to? Okay, so I'll start. I think that's a really good question, and it's one that obviously should be top of mind for a lot of people when you hear about this process. I'll say a couple of things. One, I think that just the fact that we know about the process and understand the process, you should consider a win. Because if you think about it, many of you take vaccinations or you vaccinate your kids, you have no idea what the process is, how many people were in the studies, whether there were even studies. We take a lot of things at face value. And because this is a process that the vaccination process, or the process of, sort of phase trials of getting a vaccine approved, I would venture to say that most of us had no idea what that process even was before the COVID-19 vaccination process. So I think that there is a level of transparency that naturally is going to cause people to have questions, right? Because now you're like, oh, okay, I've never thought about that, and you're hearing things. So I think that you should consider that a plus, that you even know that you should be asking these questions, because in general, that's not been the case. I think for me, a couple of things, in these vaccine trials, in these phase 3 trials, there were 30,000, 40,000 people. A typical phase 3 trial, maybe 3,000 people, right? So there were many, times more people than are usually in a trial. So even though the speed is faster, I don't think that meant that there was a sacrifice in terms of the process. So I'm encouraged by that. Out of these trials of 30, 40,000 people, 10% of them were Black, so in 75,000 people across the trials, Pfizer, Moderna, for example, 7,000 of those folks were Black. So I am encouraged. And when we think about the Hispanic Latinx population, there might have been 20%. So it's even more. So I think that I feel confident that we were represented. Some could argue that there should have been more people of color in those trials, but I think that the fact that we got that many is encouraging to me. I also think the speed was allowable because we already knew a lot about coronaviruses, and Dr. Watkins can certainly speak to this better than I can, given his expertise as a virologist. But again, a lot of the sort of building blocks and the basic knowledge around coronaviruses, that knowledge was already there. So and a lot of that technology had already been sort of in development. No, we didn't know about this novel coronavirus, but we did have a lot of other knowledge that we could draw from, and that made the process quicker. So I didn't see that speed as a negative. I felt like it was a reflection that we were leveraging a lot of what we knew. And then the thing that many of us hate is a lot of government red tape, right? I think when all of that was relaxed and things could move through the process quicker, that's why it moved through, because you didn't have all of the sort of typical red tape. But it also begs the question, like, well, why did we need to spend years and years developing things before, when we see that we can do it quickly without sacrificing quality or and effectiveness? So for those reasons, that's why I feel pretty comfortable. And I'm probably a month and a half out from my second dose of the Pfizer vaccine. So, I certainly wouldn't have taken it or recommended it for my family, friends, or my patients if I didn't trust the science.
Yeah, that was a great one. Thank you so much for that explanation. And this is funny because Dr. Scarlett and myself, we were talking about this for about an hour on Thursday in preparation for the panel today. So I remember when I think it was my first year in graduate school, one of the first viruses that I worked on was SARS. And it was a huge alarm bell ringing for all of virologists, because I think that's when we realized that we were going to have to do battle with coronaviruses over and over and over again. And I remember attending a collaboration where it was a conference where it was scientists from multiple universities that were all working together on a single grant. And we started realizing that there were thousands of coronaviruses that were currently in bats that were capable of jumping into people if given the opportunity. And that was extremely scary. And it wasn't just our group, because I was just a young graduate student at the time. I was just doing, rotations. I was just cutting my teeth. But at that time, it really kind of sent shockwaves throughout the virology community. And a lot of people started researching these viruses, because we knew that we had to be ready to produce a vaccine, when the next coronavirus came on the scene. Fast forward, MERS, or Middle Eastern respiratory coronavirus, or Middle Eastern coronavirus. It came out, and that was about 10 years ago. And at that time, we really started developing, and when I say we, I mean the scientific community at large, this kind of platform where we could plug in different pieces of the virus genome into this platform, and we could allow the cell to start making those proteins. And so we developed that technology about 10 years ago. So when a lot of people say that, vaccines usually take years, yeah, that's exactly what this vaccine took. This vaccine has been in the works for about a decade. And so all you see is, oh, now we have a vaccine that's rolling out with Moderna. But what you don't see are all of the years of painstaking work that went into that vaccine. You only see the tip of the iceberg. You don't see all that went into it. And so for all of the listeners, this vaccine had been in development, this platform had been in development for about a decade. And so now all what you're seeing is the fruits of a decade of labor. And Dr. Corbett herself had been working on this particular coronavirus research for about 7 years after graduating from UNC.
This is how I usually answer that also, in addition to, stressing how long researchers have been working on it, and including Dr. Corbett, who's from Orange County. I give this analogy, especially to community-based groups and faith-based organizations. If someone comes to me today and says, Dr. Laws, you can build a multi-million-dollar house, but you can only do it with the money that's in your bank account, it's going to take me decades to do it. But if they come to me and say, you can build a multi-million-dollar house, and we're going to give you all the money that you need, and we have the best contractors ready to pull your house together, your contractors ready to put the house together. It'll probably take, I know a really good contractor here in Chapel Hill, the Zen brothers. They could probably, if I told them money was no object, I could probably have a multi-million-dollar house by the end of the month. And that's trustworthy, that I could trust, that it's not going to fall in. The vaccines that were invested in by our United States government, money was no object. They had the best minds on ready to start working on it. And those are the two things that you need. You need the best scientists and researchers. You need money. And then, of course, you need people. And we had all of those ready. And so that is the result of what we found to be now this quick coming to market. In the minds of the public, it's quick. But as Dr. Watkins said, it took years. A lot of the research that we built upon to come that resulted in the Moderna, the Pfizer, and the Johnson & Johnson vaccines, which were already under development, taking years of brilliant researchers and innovative scientists.
I took the Pfizer vaccine back in just after Christmas, actually. And at that time, I did my own little research, and I found out about Dr. Corbett and how she was going through getting the Moderna vaccine through that process. And I also learned that this is not we didn't start from scratch. We didn't have no ideas at that moment. In fact, it's like Dr. Watkins said, it was 10 to 15 years or even longer. And actually, I believe
it's 4 o'clock.
I'm sorry. There was a vaccine, I think, for the Mediterranean one, and it was there. So I think the UK extrapolated creating a vaccine from that model. So yeah, before that, I was kind of wondering, should I not? But I felt that it was important. I also found it interesting that a lot of the doctors ended up taking the vaccine, and none of us we did pretty well. Let me put it that way. my symptoms were mostly just soreness in the arm. I did not have any fatigue. I didn't have any anxiety episodes, but just like other vaccinations that are out there, I felt confident that, that this was researched very well, and that I just said, well, like all the other vaccines out there, whether it's pneumococcus to tetanus to polio, these have been researched for many, many years. And also we needed something because we couldn't just sit there and just let all these individuals just go on with and just continue to die. Yeah, I would say that I felt confident that all these vaccines were researched very well, and actually, as I said, more than 30,000 people were studied, and I even know doctors who were part of the research study, and they said, "Yeah, this is a good vaccine." So don't feel hesitant that this has not been studied well.
And let me
Thank you,
say about the
panelists.
soreness in the arm really quickly, because I had a call. Someone called, and it was a family member who said, "Girl, you told me to take mama to get her vaccine, and she been complaining about her arm all day. You sure she gonna be all right?" And I told her it's just a sign that it's doing what it's supposed to do, probably. That the antibodies are building up and it is fighting what it perceives to be this, invasion of this virus, right? And so I want to allay concerns. You're gonna have, when you take the flu vaccine, when you take, you will have your body's response to that foreign object going into your system. And Dr. Watkins explained what it is. It's a blueprint. It's not the real virus, but that's a good sign. So that's a good sign, people. Your arm, and like I told her, your mama's arm is not gonna fall off. She is okay. She doesn't need to go to, but after a few days, contact your primary care or medical professional if you get worse and feel sicker. But that's just a sign. And that's what most of the side effects have been, just a sign that our body is building up its defense to fight off what it perceives as the virus.
Thank you, panelists. Your answers will help us with hesitation that we have among our communities of color, given our history with medical mistrust. Dr. Wally Sinay, is the vaccine safe to take during pregnancy?
So the CDC recommends that we not withhold the vaccine from pregnant individuals or breastfeeding women. So yes, it is safe as far as we know to take during pregnancy. There weren't pregnant individuals in the trial, so we don't know whether, we can't be for sure that the effectiveness and everything the data that we have is applicable to that population. However, there's no biological reason to think that it wouldn't be. And that's why the CDC has recommended that the vaccine should not be withheld from pregnant women. It is recommended that you talk with your healthcare provider around timing. Some people may choose to wait a little bit. So that is a decision that you can discuss with your provider, but it should not be withheld from pregnant or breastfeeding women.
Does the vaccine affect fertility?
Yeah, again, we don't have any data to suggest that the vaccine affects fertility. We do know that severe cases of COVID have been associated with affecting fertility, particularly for males, affecting sperm count. So again, we don't know for the vaccine, but we do know that if you get a severe case of COVID, that can affect your fertility. So that's unfortunately, there are a lot of things that we don't know. I know that there was a question around long-term side effects. And so again, because this is a new vaccine that's being administered, and you all know, you heard about when the trials were happening, we haven't followed people over years yet because we just haven't had time, although there are ongoing studies that are following people longer term. So we don't know what the long-term side effects are, but we do know for the time that we've been able to follow people what those side effects have been and how long they last. So again, that's part of really what we're hoping is that all of us want transparency and we all want to know what we can expect. And part of that means that we have to explain the limits of what we know and what we don't. And we wish we had all the answers, but the reality is that we don't. And so I think what's most important is that people are honest about, what we do know and what we don't. So we don't know for sure some of these questions that are being raised.
Yes. And from a clinical standpoint, Dr. Savio and Dr. Wale Sinay, once you've had COVID-19 infection, do you know how much immunity is developed, if immunity is developed, and if so, how long does it last?
The thought process is 3 months. And that's about the same amount of time I think there was another question. If you did get COVID, how long do you wait until you get the vaccine? The thought process is also 3 months. In regards to the vaccine itself, the thought theory is that it will last up to 3 months. We don't know beyond that if it will be longer or lifelong. I suspect it's going to be it may be that we may need a booster vaccine, I'm not sure, or we may need to test for antibodies like all the other vaccines that we do currently with our childhood immunizations. That's the theory, but we don't have any factual evidence at this time. It's too early to tell. We don't have any studies that are longer than a year to see that.
Yes. So Dr. Wale Sinay, there's a question. There's a attendee who has a sister with a very rare autoimmune disease. She has neuromyelitis optica. And in the past, when she's taken the flu vaccine, she would experience moderate to severe symptoms in about 3 days after vaccination. What would you say to her to encourage her to get the vaccine and also to say to her to reduce her level of worry?
So yeah, there are so many conditions. People have questions all the time around, different conditions that they may have and should they get it or should they not. I think the things where we are really cautious are people who are immunosuppressed. Those are the individuals for whom we're unsure about the effectiveness because again, the vaccine is designed to really boost your immune system. So if people are immunosuppressed or on immunosuppressant medications, it can make the vaccine a little bit less effective. I think in terms of the specific case, if you have neuromuscular conditions and you take a vaccine whose side effects maybe could affect, kind of cause muscle symptoms, I think that could be an exacerbation. I don't think that that's an exclusion, like that's not an absolute contraindication to getting the vaccine. So I think, like anything else, I would probably talk with have your sister talk with her clinician just to kind of think about timing. And again, I don't know her personal history or if there are any other medications that she might be on that might weigh or shift the thinking in terms of when she should get it. So I would probably definitely talk to her clinician. But again, short of being severely immunocompromised, I don't think that would be a contraindication or meaning she shouldn't get the vaccine because of that condition.
Yes, and I just want to comment that there is information on the North Carolina state's website as well as the CDC, and information that we're sharing from the state of North Carolina is that immunity may be longer than we initially thought. It may be lasting up to 6 to 9 months. And in North Carolina, the wait time for vaccination after COVID-19 is 30 days. Okay, so please stay tuned. Remember that this is an evolving process. use the information that we have at our state website and also the CDC. And at this point, I would like to thank Drs. Sinay, Laws, Savio, and Watkins for an engaging 40 minutes of question and answer on our panel. We are now better able to make informed decisions when considering vaccination against COVID-19. Thank you so much to the Chapel Hill-Carrboro branch of the NAACP and the Orange County Health Department for partnering with the Mu Omicron Omega chapter of Alpha Kappa Alpha Sorority Incorporated to make this event possible. At this time, I would like for Dr. Lonnie Merritt, if Dr. Merritt would join us with closing remarks.
I also want to just say thank you to all our panelists and also to Andrea Robinson for sharing her story today, kind of making it real, and for everyone else who's come out and put the shoulder to the wheel to try to get the message out, to shine the light on this problem that we have. And I just want to amplify a few things that Dr. Law said about how COVID really is just a symptom of the disparity in our built into our healthcare system these days. And so we need to really kind of pay attention to the social political things that we can do to probably alleviate those things to get rid of some of the cumulative disparities. And in the chat, there was a great video for that we can amplify the message here. That's just 5 minutes, put on by the Kaiser Family Foundation, that I think is one of the most concise and complete and very culturally relevant shots. I don't know how many of you have had opportunity to see it, but in the chat we will have a link to it for if everyone would like to see that. I don't want to play it. It's 5 minutes, but I think it's very smart and very good. And I know on a Saturday afternoon, everybody has things to do, and hopefully some of us will go down to the Peace and Wellness Plaza and to celebrate the life of Brianna. And with that, I would say, Grace, that were you able to put up that link to the, it's up. Okay, I would say check that out and amplify it if you can, because it's very good. And thank you, everyone. And and a special thanks to the Mu Omicron Omega AKAs for reaching out, and the health department for all that you do. And it's one other thing I want to say is the health department, as Dr. Scarlett said, it's an ongoing and shifting field. So stay current by checking out our health department and the CDC pages for any questions you might have. Thank you and good day. Bye-bye.